In my almost 37 years working in the NHS, these last few months have been the most challenging, but also they've been the most innovative in the whole of that period. And they've also provided great opportunity for our staff to demonstrate their caring attitude and the way they're up to absolutely every challenge that they face. So you're going to see in a moment some fine examples of that. Doesn't cover everything, but hopefully you enjoy what you see. Really proud of the teams that we have across the Trust and really pleased to see all of the work they've done over the last few months, and no doubt the efforts that we'll continue to put in over the winter. Thanks to all of them. Hope you enjoy the video.
My role during the pandemic, which isn't over yet, is to advise the organisation on all the steps that we need to take from an infection prevention point of view to reduce infection risks, particularly around COVID, to all our staff and service users. That makes it sound really simple, but keeping on top of ever-changing guidance, understanding this very huge new global viral threat has been really quite a significant challenge.
So my role within the pandemic was to be part of the swabbing team, and I would be on shift with two other people. One person would be the person who physically swabbed. The other role would be the person that received that swab stick and popped it into the bag ready for pathology, and there was also an admin role who would make sure all the personal details were available.
During this pandemic, I've been sitting on Silver Command and working with lots of groups to provide advice to the leadership team throughout, and predominantly my first concern was oxygen capacity across the Trust and flow throughout the Trust to ensure that we had the amount of oxygen flowing to the wards if needed, if we had to escalate the number of patients we required for a surge. Following that, it was to help advise the estates team on ventilation requirements.
Our role was to try to find alternative ways of delivering a service to our families throughout the footprint, and to also support staff in working from home and finding alternative ways of communicating within their teams.
During the pandemic, I continued in my clinical role, so I worked at the front door seeing and assessing patients with suspected and confirmed COVID, and I used that clinical role to work with all of the teams who were involved with COVID patients to establish some consistent pathways for how we were identifying, diagnosing and managing those patients and how we managed their flow through the hospital. I was also part of the infection prevention team, again giving some clinical input and helping implement all of the infection prevention policies to do with COVID.
Firstly, communication. We updated each other, we learnt from each other, we talked very openly to each other, and we pulled together as a whole team within the organisation to address the challenges COVID was presenting for us.
The speech and language therapist kind of put together a bit of procedure which we were given some vague guidelines for, and we very much tailored them for swabbing staff to begin with, so it was very vigorous with our kind of PPE, with our hand washing, and then as the criteria changed a little to swabbing staff and patients, as we were now swabbing all patients due to have a procedure in hospital, the goals and the kind of guidelines changed a little, so we had to do lots of problem solving as we went along. What also worked well was that our kind of home life was considered as well, so if we couldn't do a certain day because of childcare, that was considered, which was brilliant. And also kind of the physical layout of what we had to use within swabbing was great. So the tent, for example, got changed and got bigger and better.
We have worked well throughout it and have maintained good infection prevention and control measures to ensure that we've had very minimal nosocomial spread and very minimal outbreaks within our organisation. I think we've been very proactive in trying to recover our position as well following COVID and during the latter spells of this current pandemic by getting our recovery pathways up and running very rapidly and getting our surgical capacity up and running.
For health visiting, we found more ways of delivering information electronically, so using our social media pages and emailing. The school nursing services in Solihull delivered webinars for school staff around anaphylaxis and asthma and other conditions, and they also delivered some videos for families around hand hygiene and transitioning to school, which could be used within their social media footprint. Stop Smoking in Pregnancy, for example, had to start to deliver things virtually, so they arranged for nicotine replacement therapy to be sent directly to families rather than being collected from pharmacies. Infant Feeding delivered their sessions virtually through Zoom. Our specialist perinatal and mental health health visitors have also supported staff by delivering lunchtime sessions for them, and they also produced a wellbeing pack that actually has been distributed nationally. They've also been involved with some of the workshops and webinars from the Institute of Health Visiting as well. The Coventry Health and Wellbeing Be Active Be Healthy site have also been delivering exercise sessions for staff to keep them mobile and active because they're working from home more, and they've also been delivering Zoom buggy fit sessions. So there's been loads of different ways of working across the patch.
Generally a feeling that people wanted to work well together and wanted to manage the situation as well as we could. I also think we were very good sometimes at recognising that we're a unique hospital in a unique area, and so although we very closely adhered to national guidance, we also took into account when sometimes we needed to do something slightly different. And so some of the times where we went either slightly above or slightly ahead of national guidance worked really well for us here at Swift.
I've been a nurse for 34 years and specialised in infection prevention for 24 of those years, and I have to say this has been the greatest professional challenge of my entire career. It's been mentally exhausting and emotionally challenging, but we've got through it and we've really pulled together as a team and been very well supported by the management and the board. I feel less anxious now about a second surge. Hopefully it won't happen, but if it does, I know that we'll be able to manage it.
What a mixed emotion it's been. It's been brilliant. The fact is that I was able to help serve on the front line. I was given some new clinical roles. I was thrown in there at the deep end. Very daunting to swab someone. You know, it's something that we haven't ever done before. Yes, we deal with mouths and throats as part of our role as speech and language therapists, but this was kind of a step beyond that. So that's quite anxiety provoking to begin with, but you get used to it as you go along and you just have to get on and do that role. The experience has also been quite challenging, having to deal with home life and work life as well, having to do that balance of when can I be put on shift, when can I do my speech and language therapy work, when can I be at home to be a mum.
Obviously stressful, and certainly at the early days of the pandemic it felt like we were working against a ticking time bomb, because we had some original modelling put out by Imperial College in London suggesting that we would see a huge surge in patients requiring intensive care, ventilation and other higher levels of medical care, and we felt that we were working towards this huge surge in patients, which I'm very relieved to say we didn't get as many as some other places, and certainly that you've seen in other places around the UK and Europe and throughout the world. And I think that was the original stresses, and then I think now what's become even more of a stress is actually recovering our pathways following COVID. When we had to lock down and reduce all our services because of COVID, it was relatively straightforward, but to try and create pathways that are safe for both patients and staff and our environment, that has become more of a challenge. I think it's given me a lot of experience in working with different parts of the organisation and different team members to see how they work and understand their problems.
The experience has at times been really tricky. It's been about managing staff's expectations as well as the service expectation, because everyone has their different anxieties and different ways of managing this. There's also been some of our services like Family Nurse Partnership who have some very vulnerable young clients who found it sometimes hard to deliver things virtually. So as soon as lockdown lifted slightly, they were able to do some home visits and do some garden visits or walks in the park with those families as well.
This experience for me has been busy. I think busy is definitely the word. There were a lot of different areas that I was involved in, but I think in some ways it was also a good experience. I worked with a lot of people that I don't normally as part of my day-to-day role, got involved in a few things that I wouldn't normally, wouldn't necessarily choose to repeat it, but there have been good and bad points about the whole experience.
So without a doubt, I want to thank and praise all of our staff for their care, commitment, compassion and flexibility during this time. But on a personal level, I want to extend a huge thanks to my team and the 2 temporary staff members who joined us during the peak of the pandemic. I'm very proud of them, and I'm very proud of everything that we have achieved as a trust.
So there's certain teams that have really helped us to work together and make this a really good experience. So that is my own team, the speech and language therapists who have been redeployed to SWAB. The nurses on Oakham Ward who initially trained us, they were brilliant, and the people who chose us to be redeployed in the first place.
I think all of my colleagues that I've worked with have worked really, really well, but I think ones that deserve a special mention are the estates team. They have done a sterling job at trying to ensure that the environment is safe by increasing our ventilation, rapidly changing our air handling units to improve the air quality for our environments and protect our patients and staff alike.
I would definitely like to praise all of the staff that we've got within the teams, because ultimately everything moved very quickly in the early days, and it has been a real difference from being able to go and visit people at home and doing full assessments face to face to having to deliver things virtually. But the staff have all stepped up and they are really embracing the challenge and looking at new ways of working. There's been some massive innovation across the service, and I think moving forward that will continue as we move into the next phase.
For me personally, in terms of related to the areas where I work, as well as praising some of the very prominent people like the infection prevention team, I think I would give praise to the Oakham nursing staff. We changed Oakham from a green AMU to a COVID ward, to a CPAP ward, to a yellow ward, all within very short spaces of time, sometimes with only a few hours notice, and the Oakham nursing staff were brilliant. They just got on with it and they did what they needed to do to change the ward into what it was next going to be and what it next needed to be. And then I think, you know, there were also a few other people around the same sort of department that really just stepped up and did whatever they could do to help. The OPAT team have been very supportive to me. The acute medicine and ACPs really stepped up when we introduced things like the Febridix tests. So I think, you know, it's sometimes there's very prominent sort of stars in things like a pandemic, but there's also been a lot of people around doing small things that have had a big impact.
So I hope you enjoyed those snippets of some of the things we've been doing over the last few months. We couldn't include everyone, but I would like to thank everyone, not just those in the frontline services, those from our support services, those in the hospital, those in the community. Everyone's been fantastic. We've got a challenging winter to come, but from what you've seen, we're in a really strong position to respond to it positively.